Jennifer Tavernier. I am a nursing faculty member here at Lane Community College, and I'm here today to share with you what I did on my sabbatical project during winter 2020 term. A little bit about me. I have been a nursing instructor here at LCC since 2008. I actually am a graduate of LCC's program. I graduated in 2003 and then continued on for a master's in nursing education. And actually part of my sabbatical was to work on a chunk of my practicum hours for my D&P project. So I recently, well, about a year ago, received my doctorate in nursing practice. My goals as a nurse and a nursing educator, of course, to prepare new nurses who are ready and have the tools to advance nursing practice and to deliver care to diverse populations. So when I went back to pursue a Doctor of Nursing Practice degree, I was faced with this large number of practicum hours, 1,024 practicum hours that would, of course, been very difficult for me to complete while working full time. So I applied for a sabbatical, and my project for a sabbatical involved the completion of 384 of those required practicum hours. So during that initial chunk of my practicum hours, I developed the topic for my D&P scholarly project and kind of laid out the framework for this project. This involved identifying a nursing practice gap in an organization and in our community. And then I engaged in rigorous research related to my topic of interest. And I hope that you have lots of questions for me about my D&P project. I'm actually really excited to share with you what I found and what my project was all about. But it really centered around the opioid epidemic, which has been a national problem for us, but even more locally in the state of Oregon and here in Lane County, we really do have a very significant problem. I would love to tell you more about the statistics we have as it relates to the opioid epidemic here in Lane County. So in doing research, I found that a lot of the targeted efforts to ameliorate the opioid epidemic really centered around prescribing practice and centered around physicians or other prescribers, so physician's assistants and nurse practitioners. But really, no action has been taken that targets nursing practice, yet nurses are usually front and center for the management of acute pain in the hospital setting, and we really practice quite autonomously. So I felt that the topic for my D&P project that's centered around nursing practice and providing tools for nurses to use that would help them use multimodal non-opioid analgesia as a first-line treatment for acute pain and then bringing on opioids after. We've found that using multimodal analgesia really reduces the amount of opioids used in the hospital setting and then beyond. I would love to share more information with you about my D&P project and actually what it involved. So please, please, please come with questions. But as I said, my project involved targeting nursing practice and providing nurses with education and a tool to help them use non-opioids in the management of acute pain. So to do this, to get started on my project, and how I spent my sabbatical hours was working with professional practice leaders at Sacred Heart Medical Center at River Bend. This is a group of master's prepared nurses who work to translate research to bedside practice. I held several meetings with organizational leaders and conducted a SWOT analysis of the organization, just trying to really get a feel for how ready they would be to receive my project and my ideas, the kind of support that I would have, and then just how grounded the organization is in evidence-based practice and I had very positive results, very positive outcome there. I did spend quite a lot of my sabbatical time working on the IRB process, or the Institutional Review Board process. What I did, since this was a quality improvement project, was I applied for an exemption, which means I didn't have to go through full review. But even if you don't go through a full review, it's a very laborious process and takes up quite a lot of time. You actually cannot implement a practice change or conduct any kind of research or quality improvement project without first going through the IRB. They serve to protect human subjects, so both nurses and the patients there. After I got an IRB exemption, I held stakeholder meetings on the orthopedic unit. This was the unit I was going to implement my project on, and conducted an educational needs assessment with the staff there. So I held educational sessions with the orthopedic nurses. It was very, very well received. Then right after that, and thank goodness this was towards the end of my sabbatical, COVID-19 became a real issue, and the hospital unfortunately had to exclude all students, including master's and doctoral students, from the clinical setting. So I was not able to implement my project at that time. So what I did was I turned my project into an integrative review. So this involved quite a lot of research and a lot of writing. During my sabbatical, I experienced a lot of professional growth. I was able to collaborate with several healthcare professionals of multiple disciplines. I felt like I really enhanced my leadership skills. I engaged very deep in nursing research and evidence translation. And I was able to come up with a number of educational strategies in a cost-effective way, because I was not given a budget. The budget was basically my time. So this helped me as a nurse. It helped me in my project, helped me with the DMP project, and helped me as an educator to really come up with a lot of educational strategies that are very cost-effective and effective. So thank you for joining me in my sabbatical presentation. I hope you have lots of questions for me. I am ready to share. Thank you.